sharing this recording to you with a lot of information that's going to be sent to you if you need this recording. So we'll go ahead and get started with some introductions and also who's going to be joining me today. So my name is Alfredo Jauregui. I'm with Pan American Insurance Services, Relation Insurance. I am a senior loss control consultant out of our Sacramento office. And today with me, it's going to be Raymond Avila from our Sacramento office. Raymond?
Yeah, good morning, everyone, and thank you for joining the call.
Awesome, thank you. So a couple housekeeping items that we would like to go ahead and discuss. I know this is a very complex program that I'm sure all of you probably already got a copy of the program. Maybe you had a chance to glance through it, some of all the elements that we're going to be going over today. So housekeeping items, mute yourself if there's going to be a lot of opportunity for questions and answers. So what we're going to be doing, if you have a question that you want to ask, we can use our chat room right there. You can ask the question, and my coworker Raymond Avila is going to be assisting me also with answering some of the chat answers. If we don't get to all the questions, we will be going, we'll be copying all these questions and answers and send them out to you with all the information that you need. I'm sure there's a lot of questions that are going to be asked, and we'll try to get as much as we can today. And I just want to make sure that everybody understands that this is a very complex program, and we're here to help you and assist you with all the information that you're going to be needing to write this program specific to your operations. So let's go ahead and jump in, Ray. Are we ready?
Yes, I'm
perfect.
ready.
So we're going to go ahead and get ready with starting this presentation here. I'm going to mute a couple people. There we go. So to start off with, we're going to go ahead and do a little disclaimer about this presentation. Raymond?
Yeah, so here's the legal portion of it. These materials are solely for informational purposes and do not purport to be all-inclusive or to contain all of the information that may be desired or needed by the recipient. The recipient remains responsible for compliance with all applicable laws and regulations, and these materials are available for the recipient's use, but does not guarantee the recipient's compliance. Nothing contained herein is or should be construed as legal business or any other advice, and the recipient should conduct its own investigation and analysis of the materials contained herein and consult with its legal and other professional advisors as to determine it's appropriate. Relation Insurance Inc. and its related parties and affiliates make no representations or warranties expressed or implied as to the accuracy, fairness, correctness, or completeness of this material, and should not be liable for the content in any of the material contained herein or omitted herefrom or from any other written or oral communications transmitted in connection with these materials or any related matters. Relation makes no representations or warranties expressed or implied, guarantees or conditions of compliance with applicable laws or regulations, and such compliance is ultimately the responsibility.
Okay, Ray, are you there? Okay, so let me see here. I think we lost Ray there for a second. So what are we going to be talking today? So the table of contents, I'm sure everybody had an opportunity to glance at your program. 10 elements that we're going to be going over today in review and making sure that everybody understands your responsibility for each of these elements and what is specific information that you're going to have to write down that is specific to your operation. So, and there's also additional considerations that we're going to be discussing and going over, and also some of the forms that were provided to you that we're going to go review in detail so we understand how to fill some of these forms. So Ray and I are going to be alternating some of these elements, and we're going to go ahead and start with element number 1. And like I said earlier, you're welcome to ask any questions via the chat room. Ask your questions there, and we'll try at the end of each element. We'll have an opportunity to look at the chat and see if there's any questions that we need to answer specifically for that element. And we'll go ahead and go element by element in trying to discuss some of this information for you. And if we don't get to all the questions, we'll make sure we get a copy of all the questions and answers, and we'll be emailing those out to you after today. Also, just wanted to make a note. I know the focus and the objective of today's meeting is just to be focusing on the written program. I'm sure there's going to be a lot of questions regarding the sick pay, and there's a lot of other information that if I don't have the answer, we will get that answer to you. Also, we recommend, especially with the labor laws with the sick pay, always refer to your attorneys, like we said earlier on the disclaimer. So once again, ready, we're going to go ahead and start with element number 1. We're going to go over that, Raymond.
Yeah, so the first element is authority and responsibility. You need to identify the person who will be managing the COVID protection plan for your company, then fill their name and information below here. This person has overall authority and responsibility for implementing the provisions of this program in your workplace. In addition, all managers and supervisors are responsible for implementing and maintaining the program in their assigned work areas and for ensuring employees receive answers to questions about the program in a language they understand. All employees are responsible for using safe work practices, following all directives, policies, and procedures, and assisting in maintaining a safe work environment.
Thank you, Ray. So this element, the person who's going to be responsible for administering this program, who's going to be, we want to make sure that that person's always active, it's current. And on another note, make sure that on the footer of the company name and the implementation date of this program, make sure you write that down. And the implementation is actually when you completed this program, and it's actually going to be a program that's ready to go. So always have this program with the footer with the implementation date. So before we move on, I want to add a little bit more about this, the COVID-19 prevention program. It was adopted November 30th, so went into effect December 1st of this year. So this is an effective program that's already needs to be in place, and it needs to be already available, you know, so Cal OSHA might come out there and they might ask for this program. So it should be already in working. So let's go ahead and go to element number 2. So element number 2 is going to have a little bit more information. And as you can see in the program, a lot of the red areas, you're going to have to do a little bit of homework where you're going to have to identify specific to your operations what you're going to be doing. And I want to also let you guys know that this program was established and written by Cal OSHA. So what we did, we used their program. That's what pretty much it's up to date. It's there, it's available. And we just put it in our template. So this is a program that was written specifically from Cal OSHA. We just made a couple modifications on some of the forms and on the template as well. Element number 2, it's the identification and evaluation of the COVID-19 hazards. So what this element talks about that you will be conducting workplace specific evaluations using Appendix A, that form to identify the COVID-19 hazards. And we'll go over all the forms at the end so everybody has an understanding exactly how to fill and complete these forms. You want to evaluate employees' potential workplace exposures to all persons to whom may enter or our workplace. Review applicable and order general and industry specific guidance for the state of California, Cal OSHA, and the local health department related to the COVID-19 hazards and prevention. You're going to evaluate existing COVID-19 prevention controls in your workplace and the need for different or additional controls. You're also going to be conducting periodic inspections using Appendix B, which I'll go ahead and cover at the end as well, as needed to identify unhealthy conditions, work practices, and work procedures related to COVID-19 and to ensure compliance with your COVID-19 policies and procedures. So in this program, anything that's already in black, it's pretty much general for everybody. Doesn't matter which industry, those are pretty much going to be same policies and procedures pretty much for everybody. In the red area, it says enter other identifications and evaluation measures you will be taking at workplace. So if you want to add additional measures for a risk assessment of your operations, you would identify them there. You would write them there as well. So moving on to the employee participation, it's pretty much employees and their authorized employees representatives are encouraged to participate in the identification evaluations of COVID-19 hazards. So you want to make sure employees also participate and have the opportunity to bring any ideas or concerns wherever they're working that can be an exposure to the COVID-19 in the work areas. Employee screening. So here's a little bit where you're going to start doing some writing specifically of how you're going to operate this section right here. So how are you going to be screening employees? So there's pretty much two ways you can go about doing it. One of them, it's going to be asking the employees themselves to do a self-screening according to the Department of Health and Public guidelines, I'm sorry. Or that's one of them. Or you're going to ensure that if you're going to be doing temperature checks, that's going to be the other option. So one option is to have the employees self-screen, making sure they're reporting to work with no symptoms, no signs, and they're okay, and they're doing self-screening. And some people can even document that in a almost like a time card, but on a daily basis that they would initial that they're okay, that they don't present any signs or symptoms, and they're okay to work, and you can keep track of that. That's one way of doing it. Like I said, the other way would be if you're going to have your supervisors or foremen or someone screening by doing temperature checks. So that's going to be the other option. And you would have to identify how are you going to be screening employees when they come to work in your operations. If you're going to be doing temperature checks, keep in mind that you cannot log in people's temperatures, what they measure for that day. What Cal OSHA recommends, if you're going to keep track, it's either yes or no, they're okay to work, or no, they're not okay. You can keep track of no, the people who have no, they're on the log, and keep those for your records that you are indeed screening the employees. So that's pretty much on the identification and evaluations of the hazards for element number 2. So we'll go ahead and look at some of the questions that are being asked in the chat. Ray, do we have any questions so far?
We do, from Daniela, and she's wondering if they've already given the supervisors a similar packet. Do they take that one back and give them this new one, or do they recommend that they have both of the packets?
So if you got the supplemental COVID-19 program that was sent to you guys back in the spring, this is going to replace that program. So this is going to be the most current program that you need to have in place. So this is it. This is the most current up-to-date program that you should have, and all your foremen or workers should know that this is the most current one.
Okay, then there was one other question. For employee screening, do you recommend that we do both self-evaluation and temperature check?
I think, yeah, I mean, you can do both. You can do both, and you just want to write it down there on this section on the employee screening. When it gets to the training portion of the element, the self-screening, it's going to be one of the biggest areas that I really recommend raising awareness on the training portion. But if you're going to be doing both, you can just log them there both as well.
Okay.
Thank you so much.
So, and now for the third element.
Yes.
Which is correction of COVID-19 hazards. This is where you will describe the corrections to the hazards that you identified. The unsafe or unhealthy work conditions, practices, or problems will be documented on Appendix B, which is the COVID-19 inspections form. and corrected in a timely manner based on the severity of the hazards. On this form, you'll describe the severity of the hazard and the corrections in the time frame that you are assigning to that. Accordingly, individuals are identified as being responsible for timely corrections. So the person who is responsible for those corrections will be identified. And follow-up measures are taken to ensure timely correction.
Perfect, thank you. Thank you, Ray. So once again, in this element, there needs to be inspections that need to be conducted. They need to be recorded and keep records of that, because we want to demonstrate that we're doing that. So there's going to be a form that you can utilize to do these inspections. The question was asked yesterday on our Spanish webinar, how often should they be doing the inspections? It's up to you. It's up to you, but I would really recommend do it on a daily basis. The supervisor, foreman, whoever's in charge of that specific job site, should be doing these inspections on a daily basis. So that's my biggest recommendations, to do it on a daily basis and keep track of that inspection, whoever's in charge of that area. Perfect. Moving on, element number 4, controls of COVID-19 hazards. So physical distancing. In this element, when it's possible, we ensure that at least 6 feet of physical distancing at all times in our workplace by. So some of these red highlighted sentences could be something that you're going to be wanting to keep there, because you might be doing some of these areas. For example, eliminated the need for workers to be in the workplace, telework or other remote work arrangements. So if you have employees who are working from home, you can identify that there. You have office personnel that are working from home, so you can identify that as there. And reducing the number of persons in the area at the time, including visitors. So maybe in the break rooms areas where you want to have the least exposure of people gathering, you want to identify that that's not going to be allowed or permitted. Visual cues such as signs and floor markings to indicate where employees and others should be located in their direction of path of travel. So I encourage people putting signage throughout your facilities. And floor markings, I know we see some of those. So we go to a restaurant or a store, they put some floor markings where 6 feet of distancing people should be standing. That would probably be like in the office settings. If you have people, vendors coming in, or people from the outside, third parties coming into your operations, if you want to keep that floor markings, it's a good idea to keep that. And you can identify that there, that in your office settings, you're going to have floor markings. The next one's going to be a little bit tricky, the staggering arrival, departures, and work and break times. So I want to talk a little bit more in depth about that. This year, we have some clients that actually were cited by Osha, because when Osha arrived to the work site, they had employees under a shade structure. This is in the ag industry. They had some people in the shade structure that did not accommodate enough shade at 6 feet of physical distancing. So this company got cited. So if you're not going to be provided enough shade structure for the outside, you want to consider staggering the arrivals, departures, and break times. And I would really highly recommend you keep track of that. When people go to breaks, that you can prove that you're staggering breaks and arrivals and departures. So if you're not providing enough shade structures for working outdoors to accommodate 6 feet distancing for all your employees, you're going to have to take into consideration that maybe staggering arrivals and breaks is going to be the best option for you. Also, just work process and procedures such as reducing production speed to allow greater distances between employees. This could be something that if you have a processing plant, a packing house, if people are working too close to each other, maybe consider looking at your procedures for reducing the production speed. Maybe you're going to have less personnel working on that line. And that's another situation you're going to have to assess to making sure you have that physical distancing throughout your facilities wherever employees are going to be working. So the physical distancing is something that you're going to have to do some homework and identify specifically what you're going to be doing. Also, if you have several different operations within your company, you want to identify those as well. If you have outdoor activities, if you have indoor activities, you also have the office buildings. So all those have to be identified. How are you going to be enforcing the physical distancing by your written program here in this section? Perfect. Moving on to the face coverings. Pretty much here it says that you will be providing undamaged face coverings and ensure that are properly worn by employees over the nose and mouth when indoors, and when outdoors less than 6 feet away from another person. So pretty much this element, it's going to say that you will be providing. I would write there that each foreman or supervisor or manager, whoever's in charge of that operation, is going to have available face coverings, and when they need it, they should be able to provide the face coverings. So this is pretty much general standard for all industries. One of the bulletins in the bottom, which says the following are exceptions to the use of face coverings in our workplace. So bulletin number 3 there says employees wearing respiratory protection in accordance with Title 8. So what that means, if some employees have to wear an actual respirator, so that would be an exception to wearing a face mask because they're already wearing a respirator. And if they're wearing a respirator, that involves another different requirement with the medical evaluations, the fit testing, and its own requirements for the fit testing. So if that's not something that you are going to be doing with a respiratory exception there, you can delete anything that cannot be applicable to your operation if you're not involved with any of that. In the section of the engineering controls, we will implement the following measures for insurance where we cannot maintain at least 6 feet between individuals. So packing houses, I know there's some operations also outdoors. For example, I know in the beginning of the first quarter, there's going to be a lot of machinery that's going to be transplanting a lot of our ag tomato transplanters. So they have the seats on the transplanters that are with closer than 6 feet. So what you can write there, you're going to put some barrier protection between each seat. So you want to identify pretty much in that section, if you cannot maintain 6 feet apart, how are you going to put any control engineers by doing some plexiglass or whatever barriers that you're going to have in between the employees. So in that section, that's where you would write all those measures that you're going to be doing specifically for that job and that task. So that's very important. Identify the tasks, the jobs that are going to be doing these engineering controls. We will maximize the extent feasible the quantity of outside air for our buildings with mechanical or natural ventilation system by. So here, once again, in the circumstances where the amount of outside air needs to minimize due to the hazards such as heat and wildfire smoke, how the ventilation system will be properly maintained and adjusted whether you own and operate the building or not, whether it is possible to increase filtration efficiency to highest levels compatible with existing ventilation system. So here you would write down once again the specific instructions of the ventilation if you're working in a packing shed or a processing plant. Make sure that those are being identified under these sections of the outdoor air for the buildings or mechanicals that need ventilation systems.
Alfredo?
Yes.
I'm sorry to bother you. There was a good question on the face coverings.
Yes, please.
And that question was, does that mean providing masks daily, or would we be okay with providing cloth masks quarterly with instructions, plus disposable masks when needed?
Yeah, I think sometimes employees think that they can get a face covering every day. So you would have to make sure you have those requirements for your company, how often you're going to be providing a face mask. And if they lose it or they forget it, you will be providing one. But you write your own rules of how often you want to be offering those face coverings, as long as everybody wears them.
Yeah, on that.
Okay, did we answer that?
Yes.
Perfect. Okay. I think we left off on the cleaning and disinfecting section here. We will implement the following cleaning and disinfecting measures for frequent touch surfaces. This section here, it's going to be your responsibility to identify how you're going to be cleaning and disinfecting at the beginning of each shift. You know, you want to write down exactly who's going to be in charge of what disinfecting measures you're going to be taking to making sure you're doing that. For example, outdoors in the ag industry, portable restrooms, the water igloos, the shade structures, is the foreman supervisor going to be in charge of doing that on a daily basis? And I would document that, keep records that they're doing that. That's very, very important. So here, ensuring adequate supplies and adequate time for it to be done properly, informing the employees and authorized employees representatives of the frequent and scope of cleaning and disinfection. So you want to let the employees know that the areas of the work that they're being worked on, they're going to be disinfecting on a daily basis. You want to communicate that to your employees so they know that the company is taking that step to disinfect the areas where they're going to be exposed. Next section, should we have a COVID-19 case in our workplace, we will implement the following procedures. Here, you would describe the cleaning and the disinfection will be done for areas, materials, and equipment used by a COVID-19 case during the high-risk exposure period. Address whether an outside service will be used or how the employees are properly equipped and trained. So if you have a COVID-19 case in your operations, you know who's going to be responsible in going to that area where that employee was working and how that disinfection and cleaning is going to be taking place. You want to write that specific procedures there. How are you going to go about doing that whenever there is a COVID-19 case that person was working at? In the shared tools, equipment, and personal protective equipment, PPE section. So here, PPE must be not shared. So once again, tools, equipment, face shields, you know, I think that we want to really train our employees. They should not be sharing any PPE. Here, you would also write items where employees come into regular physical contact, such as phones, headsets, desks, keyboards, writing materials, instrumental, and tools, must also be not shared to the extent feasible. Where there must be sharing the items will be disinfecting between the use of describe how this will be done in your workplace, such as the cleaning, sanitizing, crew, providing the employees with materials and training to do it themselves. One of the biggest highlights here on that really comes to mind, it's the office environment, especially in the break rooms. If you have microwaves, if you have any utensils there for people that are sharing, you know, in a break room. So who's going to be responsible to making sure that these items are being sanitized? It's very important in the break room. You know, some of the people stop using the water igloos and have bottled water. We've seen that for as much as time possible to be in contact with some of these surfaces in the break rooms. So here you can identify that at what you're going to be doing, mostly in the office environment. I'm not too sure that's going to affect a lot outdoors, because usually people have their own PPE assigned to them. So that's my recommendation right there. Sharing of vehicles will be minimized to the extent feasible on the high touch points. For example, steering wheels, door handles, seatbelt buckles, armrests, will be disinfected between users. So here, vehicles, to me, it can be a company vehicle. If you have multiple drivers using that same vehicle, so there needs to be some kind of sanitize between each operator. That would be the same thing for equipment outside, ATVs, tractors, or any kind of a piece of equipment that people are sharing. You know, who's going to be sanitizing? Maybe it's the same employee at the end of the shift. When he's done, he's responsible of sanitizing, or the person who's coming in second shift, he's going to be responsible of sanitizing that area. So here you would write that that specifically to your workplace, how you're going to be doing that for vehicles or equipment or anything that's specific to this element right there. The hand sanitizing, in order to apply effective hand sanitizer procedures, so here you would want to make sure you evaluate hand washing facilities. Outdoors, sometimes depending on the crew size of the employees, if you only have one portable, only one washing facility, are you going to be providing extra hand washing facilities? You want to write that down there in this element and determine the need for additional facilities. That's what I'm just talking about. Encourage and allowing time for employees hand washing, providing employees with an effective hand sanitizer, and prohibit hand sanitizers that contain methanol. So you want to make sure if you have a hand sanitizer, you want to write that there, that you have these throughout your facilities or job sites, outdoors, or you can have them in your shade structures, the hand sanitizer, along with extra hand washing facilities. So personal protective equipment use, control employees exposure 19. We evaluate the need for PPE such as gloves, goggles, and face shields. So pretty much, once again, this here, it's referring to what we talked earlier on the respiratory protection, that it's going to go more requirements for the testing and the medical evaluations if you have employees wearing respirators for the task of application maybe of pesticides. So that's going to be something that you would identify there if you're going to be doing that they do not need to wear face cover because they're already wearing the respirator. But if they're wearing a respirator, there's more requirements that I'm just mentioned right now. So that's element number 4. We'll go back to any questions anybody has. And you're welcome after every element. If you have a question that you want to ask, you can open your microphone, unmute yourself, and you can ask the question, and we'll try to answer it as well. So we want to make sure that everybody has an opportunity. If there's any concerns or questions they might have to each of these elements, we'll go ahead and give that opportunity as well. Ray, any questions that we need to try to answer?
Not that I see at this time.
Perfect. So we'll go ahead and move on. Element number 5, Ray.
Yeah, so element number 5 is investigating and responding to COVID-19 cases. In this element, you'll describe how you will respond when a positive COVID test is determined. And you'll do this by using the Appendix C, investigating COVID-19 cases. And on this form, you'll describe how employees who had potential positive tests in your workplace will be offered COVID tests at no cost during work hours. You will also need to provide information as the benefits described in your training and instructions and the exclusion of COVID-19 cases. And we'll be discussing this in the information below. The next couple elements will describe that.
Hi, Alfredo. I think you're muted. Excuse me.
Yeah, you're muted, Alfredo.
Oh, I'm sorry. Thank you so much. So in this section here, we're going to go ahead and talk a little bit more about the Appendix C when it comes to that form, how to fill it out. But we'll get to the offering of COVID-19 testing at no cost during work hours, because I know that's being asked a lot. if it's work related, not work related, do I have to pay? Do I don't have to pay? So there's a section that we're going to discuss a little bit further on in another element. So
Alfredo,
yes.
I'm sorry, there is a question here. And it says, are there any resources for employers to be able to afford paying for employee COVID tests?
Not that I'm aware of. I think what we need to do is making sure you're working with your local clinics that are in the local the workers' comp medical providers that you guys are working with, and find out if there's actually how much that costs, and if there's also free testing in your area. That also you need to find out exactly where the free testings are being done. So when you have to send employees, or you want to recommend employees to get tested, that there's a free site that there's available within a reasonable distance from your operation. Because I know there's free testing somewhere, so you have to find out where those located, and you can write it down here on your program where these free testings are going to be available for employees to go.
And Alfredo, there's another question. If an employee tested positive for COVID-19 and outside of the workplace, but they wanted to return to work as soon as possible, so they went out and paid for a test themselves, does the employer need to reimburse them for the test?
Does the employer need, so if it happened outside of work because he was exposed to a family member, or he got it off work, and no, he doesn't have to reimburse because it happened pretty much outside of work. Whenever there's an exposure, for example, if an employee comes to work and he was working already in your work area, and he becomes positive with a case, so the people that that employee was exposed to, those are the people that you would want to recommend get tested, and those are the ones that there should be no cost to those employees who are going to be recommended to get tested, and during the working hours.
So the follow-up to that, if the employer was asking the employee to do the test, then it would be on the employer to pay?
Exactly.
And one last one, some people use like a uniform service that will supply cloth masks and are laundered weekly, but are not assigned to a specific employee. Is this acceptable?
Let me get back to that question. Ray, keep that question in mind at the end, and we'll try to get that answer. I'm not exactly sure right now on that, specifically on the uniforms, and we'll try to get that answer hopefully by the end of this webinar on that one.
Okay.
So moving on to the element number 6, system for communicating. In this element, you want to make sure that you have a two-way effective communication to your employees. So this means your supervisors, foremen, management are communicating with all the employees of all the hazards, all the risks, all the training, and also that the employees can come to you, management or anybody, without any fear of reprisal. So if you want to write down their names of who the employee should be reporting in case they have a possible hazard or symptoms, on that first bulletin, you can write down there, or you can just leave it, employees should report it to their immediate supervisor if they have any possible symptoms or hazards. You would, on that first bulletin where it says describe how this will be accomplished in your workplace, that's what I would write there. Our procedures and policies for accommodating employees with medical and other conditions that put them in increased risk of severe COVID illness. That's pretty much general for everybody. Where testing is not required, how employees can access COVID-19 testing. So here, once again, it will fall back to what we were talking about earlier. Determine what options are available for employees to obtain voluntary testing, be it employees provided throughout health plans or local testing centers. So you would write those down there. The names of the clinics or the testing centers and the addresses, I would write those, identify those there. The purpose is to give employees the tools to get tested when they have symptoms to reduce the likelihood of bringing the virus to work. This type of voluntary testing does not have to be provided by the employer. So once again, you can provide information to the employee if employee might be exposed outside work because of a home situation that they can be exposed. You can give them those recommendations where they can get tested. Or if it happened at work, you want to have identified those clinics and the testing centers that the company is utilizing, maybe at no cost. And if there's a cost associated because of work-related situations, that the employee understands that there's not going to be a cost with it, that the employer is going to be picking up the tab for that testing. Next bulletin, in the event we're required to provide testing because of workplace exposure or outbreak, we will communicate the plan for providing testing and inform employees of the reason for testing and the possible consequences of a positive test. So once again, here it's talking about an exposure or an outbreak, and you want to identify that to the employees that testing is recommended because they might be exposed to someone who tested positive, and have a plan that will be accomplished at no cost to the employees during the working hours. So it's pretty much repetitive here of what we've been talking about, of how you're going to be providing that information to the employees and where they can get tested. And we'll be talking a little bit more on a outbreak and what a major outbreak is on the additional considerations elements as well. So information about COVID-19 hazards, employees, including their employees and the contact with workplace may be exposed to if it's not being controlled, those hazards, and for COVID policies and procedures. So here, if you have additional information that you want to communicate and implement in the workplace, you would write it down here. If you want to be more specific of anything that you're going to be doing, that in addition to these bulletins are pretty much generalized for everything. So that was element number 6. I know it's a little bit sometimes unclear exactly how you want to write down specific for the operations, but Osha did a great job, and I am very happy to see that when they come up with a regulation, they come up with a template model program that they're helping us. Because when the regulation pretty much was adopted on November 30th, how do we start from scratch writing a program? And they didn't take that long. It took maybe a week or two when they came out with this template. And they did a very good job helping all the employers how to write this program. So pretty much everything that they wrote here, it's there for us. We just have to make it specific to what you're going to be doing for your operations. So I'm thankful that they did that. Usually when a regulation comes up, they usually don't provide written programs or help that we need. We have to pretty much do it from scratch, and it makes it a little bit more complicated, especially on a complex program like this COVID-19 that I know we're all pretty much stressed out on how do we write this? How do we implement this? So I'm glad that they did that. Moving on to element number 7, and before we move on, Ray, do we have any more questions on element number 6?
No, we don't.
No, awesome. Okay, so element number 7, Ray, you want to go ahead and read this for us?
Sure. So element number 7 is training and instruction, and that outlines the training and instructions that need to be provided to your employees. You'll need to discuss your COVID-19 policy and procedures to protect employees from COVID-19 hazards. You'll need to provide information regarding related benefits to which the employee may be entitled under applicable federal, state, or local laws. You'll need to describe COVID-19 as an infectious disease that can be spread through the air, can be transmitted when a person touches a contaminated object and then touches their eyes, nose, or mouth, and it's an infection a person may have no symptoms of. You'll also need to describe your methods of physical distancing of at least 6 feet and the importance of combining physical distancing with the wearing of face coverings. The fact that particles containing the virus can travel more than 6 feet, especially indoors. So physical distancing must be combined with other controls, including face coverings, hand hygiene, to be effective. The importance of frequent hand washing with soap and water for at least 20 seconds and using hand sanitizer when employees do not have immediate access to a sink or hand washing facility, and that hand sanitizer does not work if the hands are soiled. You'll need to discuss the proper use of face coverings and the fact that face coverings are not respiratory protective equipment. Face covers are intended to primarily protect other individuals from the wearer of the face covering. COVID-19 symptoms and the importance of obtaining a COVID-19 test and not coming to work if the employee has COVID-19 symptoms. And then you'll describe any other aspects of your training being implemented to your workplace. And you'll also have to have them fill out the COVID-19 training roster to document that this training was done.
Thank you, Ray. Every single element is very, very important. I know all of them are important, how we're going to ensure the safety of all the employees while working your operations. Element number 7, I want to really emphasize a little bit more on element number 7, the training instructions. We can have the best written program there in a binder, but if we are not training, raising awareness to the employees in a very effective manner, nothing's going to happen. So I really, really encourage everybody to make sure that all your supervisors, managers first, they are properly trained with all these requirements, and that we are training our employees effectively, you know, on all these measures that we just identified. So,
Alfredo?
Yes.
I'm sorry to interrupt. There are 2 good questions here. And one is, has Cal OSHA released a deadline for COVID employee training?
So this was established November 30th, you know, so effective December 1st, this should have been already implemented. And trainings for the COVID should have been done immediately. You know, we should already have been doing employee training since March, pretty much, or February, since this COVID pandemic started. So deadline, there's no deadline pretty much. You have to do it ASAP. All the employees should be trained on all these measures.
And then Alfredo, if you provide an employee a list of free testing areas, but the employee decides to go to a facility that charges a fee, is the employer responsible for paying for the employee's test?
Let me get back on that question, Ray. Keep that one in mind, because I want to legally find out if they are required to reimburse that employee if he chooses. Some of these questions are more legally that we need to be careful in answering, and we need to get advice from a legal source. So we want to make sure we have the right answer. I think, you know, we'll get all these questions. We'll go ahead and keep record of all these questions. And like I said earlier, we'll get all these answers back to you guys and email all you guys the questions and answers portion. So once again, on the training aspect of this element, very, very important to make sure that we're training our employees properly. You know, we've been out there, myself, been out there to a lot of our job sites, and we still see a lot of employee gathering during lunch hours, during breaks, no face masks that people are wearing. People are carpooling, 3, 4, 5, 6 people in a van. Nobody is wearing face coverings. So how do we raise awareness to all the situation that's happening? You know, so it's our responsibility to make sure it's being effectively communicated to the employees, the importance of this. The employees of people that have had signs and symptoms, they should not report to work. We're still having employees showing up to work where a family member has tested positive and they're still coming to work. They're not reporting that to management or supervisors. So we really need to emphasize the importance of all this by properly doing an effective training. And everything starts with making sure that our supervisors, management are training effectively. Looks like we have another question. Okay, looks like somebody was having difficulty with the audio. Can you hear me very good, Ray?
Yeah.
Sound? Okay.
Yeah.
Perfect. So element number 8, let's talk about element number 8, the exclusion of COVID-19 cases. In this section where we have COVID-19 cases in our workplace, We will limit transmission by ensuring the COVID-19 cases are excluded from the workplace until our return to work requirements are met. Excluding employees with COVID-19 exposures from the workplace for 14 days after the last known COVID exposure to the COVID-19 case. Continuing and maintaining an employee earnings seniority on all other employees' rights and benefits wherever we demonstrate that the COVID-19 exposure is work-related. This will accomplish by, so you there would write down exactly how you're going to accomplish by providing sick leave benefits, payments from the public sources or other means of maintaining earnings, rights, and benefits were permitted by law when covered by workers' compensation. So once again, the exclusion here, it's very important. You know, if you know that it might be a work-related, let me see where I'm at right there, I'm sorry. So if you can show that it's work-related and you have to exclude employees, so they're gonna have to continue their earnings and seniority and all the benefits. You will also let employees know that they have these benefits available to them. So this one is another information here you would write down specifically how you're gonna go about identifying these benefit payments. Any questions on that, Ray?
No.
Let's move on to element number 9.
So element number 9 addresses reporting, record keeping, and access. And in this, you're going to describe your policy to report information about COVID-19 cases at the workplace to the local health department whenever required by law, and provide any related information requested by the local health department. You'll report immediately to Cal OSHA any COVID-19 related serious illnesses or deaths as defined under CCR Title 8, Section 330 of an employee occurring in our place of employment or in connection with any employment. Was somebody starting to ask a question there? Or?
No, go ahead.
You will maintain records of the steps taken to implement your written COVID-19 prevention program in accordance with CCR Title 8, Section 3203B. You'll make your written COVID-19 prevention program available at the workplace to employees, authorized employee representatives, and to representatives of Cal OSHA immediately upon request. And you'll use Appendix C, Investigating COVID-19 Cases form, to keep a record of and track all COVID-19 cases. This information will be made available to employees, authorized employee representative, or as otherwise required by law with personal identifying information removed.
Thank you, Ray. So once again, the majority of this element, it's pretty much a standard already. So we have to comply with these bulletins. They're listed. Those are the requirements under this regulation. If you have an additional measures that you are taking, you would identify them there in additional to this element. Moving on to element number 10, I'm sorry, it's return to work criteria. As we can see here, once again, these bulletins are the standards already. There's nothing else to be added specifically to your operation. These 4 bulletins are going to be required for everybody. The COVID-19 cases with COVID-19 symptoms will not return to work until the following have occurred. At least 24 hours have passed since the fever of 100.4 or higher has resolved without the use of fever reducing medications. COVID-19 symptoms have improved. At least 10 days have passed since COVID-19 symptoms first appeared. COVID-19 cases who tested positive but never developed COVID-19 symptoms will not return to work until a minimum of 10 days have passed since the date of specimen collection for their first positive COVID-19 test. A negative COVID test will not be required for an employee to return to work. So you cannot ask an employee to get tested and show proof that they're negative in order for you to accept them to come back to work. So we cannot do that. So that's very, very important, because I know some people are requiring to get a negative test before they're allowed to go back to work, and we cannot ask for a negative test.
So Alfredo, excuse me, this is actually a really good question this time of year. And it's, what is their legal obligation as an employer for employees returning from another country?
So I know there's a California pretty much self-quarantine for 14 days. It's not like a law, it's a self-quarantine that people should quarantine themselves for 14 days before they come to work. So that's what the governor pretty much stated for the people who are traveling outside state in other countries. Can you personally do that and beyond requiring people to quarantine themselves? That's a question, right, Ray?
Yes.
Yeah, so let's ask that question to one of our attorneys that we use for a lot of these sources. And I am believing that we cannot do that, but we'll ask that question and get a test, an answer back to you guys on that specifically.
And then would they be able to require travelers to take a test before returning?
Can you repeat that?
Would they be allowed to require travelers to take a test before returning?
Once again, the required, we cannot do that. We cannot require people to take a test, and we cannot require them to show us a negative test so they can come back to work.
Okay, and then if an employee came in contact outside of work with someone who was COVID positive, but the employee tests negative, are they still required to isolate for 10 to 14 days?
That is correct here on the return to work criteria. It's stated right there. COVID-19 cases tested positive but never develop a COVID-19 system will not return to work until a minimum of 10 days have passed since the date of a specimen collection for the first COVID-19 test. So pretty much that answers that right there, Ray.
Thank you.
So to clarify why I'm asking regarding travel, to me, it just doesn't specify the return to work criteria. It doesn't sound like, it sounds like they're talking about people with symptoms or are quarantined, not necessarily just because they traveled. So I guess to me, it's just not specific enough to give a solid answer. But if you think that just return to work is like super blank, then that would be valid.
Yeah, so I know it's not like 100% there on the traveling portion, you know, outside of state or outside of country. But we're going to ask that exactly. I know we've been talking to some of our legal advice, and it's on people traveling outside the country. You know, are the companies okay to require employees to get testing? And I know that I've heard that we cannot require people to get tested, or have the people be quarantined for 14 days after they come back. You know, I think the law was that people need to self-quarantine themselves. But you as an employer, the question is, can you require them to self-quarantine? Is that correct?
Yes.
Yes,
Yeah, that
okay.
was one question. And then the other was if you can require them to test.
Yes, so on the requirement to test, no, that will be a definite answer right there. And I'll just get back on the requirement if you can require them to quarantine for 14 days. So,
and Alfredo, I'm
yes.
sorry. In regards to if the employee chooses to quarantine for 14 days, is the employer required to pay them during this time?
Yeah, that's an interesting question, because I know it's been asked a couple of times, and the answer would be no. I mean, because it was not an exposure at work, you know, so there they don't have the benefit of the sick pay that they're required to pay them.
And one last one, real quick. Sorry. Can other employees express their concerns or file a complaint, I guess, to Cal Osha in regards to those employees coming back from another country?
Can an employee report to who? I'm
To
sorry.
Cal Osha in regards to those employees coming back from another country?
Well, the employees have the right to inform any agency without fear of reprisal. You know, we can't do anything about it. If an employee takes upon their own action to report it to Cal Osha, there's nothing we can do there. We cannot hold them accountable or reprisal them for reporting to Cal Osha. You know, if the employee wants to call Cal Osha because the company is not doing what they're supposed to, we can't stop them from doing so.
Okay. That's
so
it.
I just want to emphasize a couple things on these 10 elements. So I don't want to talk too much about the benefits of the sick pay, but I know they're going to expire December 31st. We do not know of those 80 hours or that sick pay. They're going to do an amendment and extend it for next year, but that's going to expire December 31st on that benefit of the sick pay. And also this written program on the COVID-19 prevention program, this is only a temporary program. All these elements are only in place temporary until October 1st of 2021. So 10 months, pretty much, we're going to be dealing and ensuring and making sure this is an effective program in our operations. Hopefully they do not extend this program further out. We do not know that. We don't want that to happen because I know it's a lot of work for all of you guys and all of us. But right now, this is just a temporary measures until October the 1st of 2021. So moving on to the additional considerations, number 1. Ray, you want to read this one for us?
Sure. There was one last question here really quick. If an employer agrees to pay a returning employee during the quarantine, so that can they be asked to stay at home?
If an employer pays someone from coming out for 14 days, can
the employer ask them to stay at home while they're being paid?
That's going to be pretty much, it's up to the employer. I think right there, they want to do that. But let's keep that question in mind. I want to get legal advice on that question, if they can do that.
Okay, and then one last thing, I guess based on what you had just talked about, Alfredo, if there's a COVID-19 case in the first week of January, work-related, they no longer qualify for the 80 hours of pay?
That's correct. It's going to be expired December 31st. People would use their sick pay, the 3 days that they have, or any other outside benefit, disability, if they qualify for that. So right now, we haven't heard that there's going to be an extension on the sick pay. I would recommend you guys ask your labor attorneys that you guys are working with if you have any questions specific to the sick pay. We don't know if that's going to be an extension amendment for further out, but it's going to expire December 31st.
And since an employer can't ask for a negative test for someone to return to work, do they still allow, or are they required to allow an employee to return to work if they still sound sick or ill?
No, I mean, if the employee's still sick and doesn't feel well because any of the symptoms, they cannot require them, and they can still stay home. And obviously the benefits that we were talking about earlier, that employee can get some of these benefits by a disability benefit or other benefits. But I think if someone's sick, they should not be coming to work, even though those 10 or 14 days have passed by. They cannot require them to have them return to work.
Okay, and then do the is the sick hours from the employer paid only if the exposure happened at work?
That is correct.
Okay.
So additional considerations, this section is pretty much going to be pertaining to all industries. You want to have this already in your program in case there's multiple COVID-19 infections and COVID-19 outbreaks. Ray, you want to read this one for us?
Sure. And there's one, sorry. Can you please elaborate more on what is expiring December 31st?
The 80 hours of the sick pay.
Okay. And then how would you be able to determine that an employee got COVID at work versus out of work exposure?
That's always going to be a gray area. I think that's something that's not 100%, sure that a medical provider or workers' comp would determine if it really happened at work or happened outside work. That's something that's not yet to be investigated. It has to be done with the investigation portions. Well, I'll get to the investigation portion form, and then maybe we can answer that question a little bit better. So let's move on, Ray, on the considerations, and we'll read some of these questions at the end.
Okay.
Yes.
So additional consideration. what happens when you have multiple COVID-19 infections and COVID-19 outbreaks. This section of your COVID protection plan will stay in effect until there are no new COVID-19 cases detected in your workplace for a 14-day period. COVID-19 testing will be provided, COVID-19 testing to all employees in our exposed workplace, except for employees who were not present during the period of an outbreak identified by a local health department or the relevant 14-day period. COVID-19 testing will be provided at no cost to employees during employees' working hours. COVID-19 testing consists of the following. All employees in our exposed workplace will be immediately tested and then tested again 1 week later. Negative COVID-19 test results of employees with COVID-19 exposure will not impact the duration of any quarantine period required by or orders issued by the local health department. After the first 2 COVID-19 tests, we will continue to provide COVID-19 testing of employees who remain at the workplace at least once per week or more frequently if recommended by the local health department until there are no COVID-19 cases detected in our workplace for a 14-day period. We will provide additional testing when deemed necessary by Osha. Exclusion of COVID-19 cases. We will ensure COVID-19 cases and employees who had COVID-19 exposure are excluded from the workplace in accordance with our COVID protection plan exclusion of COVID-19 cases and return to work criteria requirements and local health officer orders if applicable. Investigation of workplace COVID-19. We will immediately investigate and determine possible workplace-related factors that contributed to the COVID-19 outbreak in accordance with our CPP investigating and responding to COVID-19 cases. COVID-19 investigation, review, and hazard correction. In addition to our COVID protection plan, identification and evaluation of COVID-19 hazards and corrections of COVID-19 hazards. We will immediately perform a review of potentially relevant COVID-19 policies, procedures, and controls and implement changes as needed to prevent further spread of COVID-19. The investigation and review will be documented and include investigation of new or unabated COVID-19 hazards, including our leave policy and practices and whether employees are discouraged from remaining home when sick, our COVID-19 testing policies, insufficient outdoor air, insufficient air filtration, lack of physical distancing, updating the review every 30 days that the outbreak continues in response to new information or to new or previously unrecognized COVID-19 hazards when otherwise necessary. Implementing changes to reduce the transmission of COVID-19 based on the investigation and review. We will consider moving indoor tasks outdoors or have them profoundly performed remotely, increasing outdoor air supply when work is done indoors, improving air filtration, increasing physical distancing as much as possible, respiratory protection. Notifications to the health department. Immediately, but no longer than 48 hours after learning of 3 or more COVID-19 cases in our workplace, we will contact the local health department for guidance on preventing the further spread of COVID-19 within the workplace. We will provide the local health department the total number of COVID-19 cases for each COVID-19 case, the name, contact information, occupation, workplace location, business address, the hospitalization and or fatality status, and North American Industry Classification Section Code of the workplace of the COVID-19 case, and any other information requested by the local health department. We will continue to give notice to the local health department of any subsequent COVID-19 cases at our workplace.
Thank you, Ray. So in addition, on this additional consideration, I'm warned, this is pretty much going to be something that I would keep in my program just in case there is a multiple COVID cases, 3 or more in 14-day period. And this is pretty much per job site. It does not mean for your whole company. So if there's 3 cases in a specific job site, that would be a multiple COVID case infection for that area or outbreak. So I know there's some questions and people were confused, 3 cases in the whole company. No, it would just be specifically for that job location.
And
you would have-
Alfredo, I'm
Yeah.
sorry, in regards to that, the 3 cases, does that, do those cases have to be work related or can they be just employees at the same work site?
3 employees at that same job site. Work related, it's pretty much this initial considerations. Yeah, it would be work related.
Okay, so if 2 got it at work and 1 got it at a family party, you don't have to report that then?
That's correct.
And then,
Now, reporting to Cal OSHA, I know a lot of people have still a lot of doubts. When do we report to Cal OSHA? So Cal OSHA needs to be reported in case an employee it's hospitalized. It's considered a serious injury or illness. That's when Cal OSHA needs to be notified, even if it's just 1 employee.
and then Alfredo, the EPSL hours, the 80 hours, is that a one-time use, or if someone gets it again, do they get another 80 hours?
No, they don't. They only qualify for 1 time. So moving on to consideration number 2, this is also one of the major COVID-19 outbreaks. Once again, this is something that we would not want to experience of 20 or more cases within a 30-day period. You want to have this process and procedures in place in case this was to happen. So additional consideration number 1 and number 2, I would keep in your programs, and you will implement all these requirements for the testing, for the exclusion cases, for the hazard correction, the notification of local health department, and reporting it to your local health department that I just mentioned right now. So here on the additional consideration number 2, it's pretty much a standard, you know, of what all these requirements are pretty much you're going to have to be complying with. I don't want to read every single bulletin here on this additional. Pretty much they're the same, and a little bit different, but on the majority of the, let me see here. I'm sorry, additional consideration number 3. So I want to move on to consideration number 3. It's if you're providing housing, this is going to be a big task for you to identify all the hazards, all the requirements. And this section pretty much it's going to be very specific about your housing that you're providing. This also applies for pretty much the following. In this section, you will need to add in your program, if you have workers and employer providing housing. Employers providing housing is any place or area of land or a portion of the house accommodation or property upon which a housing accommodation is located, consisting of living quarters, dwelling, boarding house, tents, bunkhouses, maintenance of way car, mobile home, manufactured home, recreational vehicle, travel trailer, or other housing accommodations. Employer providing housing includes labor camp, whether the term is used in Title Section 8, so pretty much labor camp. The employer provided housing may be maintained in one of the or more buildings or an area set aside and providing for parking and mobile homes or camping. Employer providing housing and housing that is arranged for providing by employer, the person or entity of workers, in some cases to workers and persons in their household, in connection with the workers' employment, whether or not rent or fees are paid and collected. So this section does not apply to housing provided for the purpose of emergency response, including firefighters, rescue, evacuation, and support activities, directly aiding response such as utilities, communications, medical operations. So that does not apply to that. Or the employer is a government entity, or employer is provided temporary by a private employer and necessary to conduct emergency response operations. So that section does not apply for this housing element. So the requirements below for physical distancing and control face coverings, cleaning and disinfecting and screening, isolating COVID-19 cases and persons for COVID-19 exposure do not apply to occupants such as family members who maintain a household together prior to residing in employees provided housing, but only when no other persons outside the households are present. So here you would have to write all these measures specifically to the housing that you are providing. Assignment of housing units, we will ensure that the share housing units assignments are prioritized in the following order. Residents who usually maintain a household together outside work, such as family members, will be housed in the same housing until without other persons. Residents who work in the same crew or work together in the same work site will be housed in the same housing until without other persons. Employees who do not usually maintain a common household, work crew, or work site will be housed in the same household housing unit until when or other housing alternatives are possible. So this is how you assign people on the housing if you're providing housing, especially labor camps or people who have H-2A programs who provide housing. This is going to be a big element for you to make sure you have all these measures identifying your program, what you're going to be doing. The physical distancing controls, how you're going to ensure that. I know there's requirements for at least 6 feet of physical distance between the residents and the housing units. Common areas and other areas of premises. Beds are spaced at least 6 feet apart in all directions and potentially maximize the distance between sleepers, heads. For beds positioned next to each other, side to side, beds will not arrange so that the head of one bed is next to the foot of the next bed. For beds positioned across from each other, end to end, the beds will be arranged so that the foot of one bed is closest to the foot of the next bed. Bunk beds will not be used. Maximize the quantity of supply of outdoor air, increase filtration efficiency for the highest level, compatible with existing ventilation system in the housing unit. So housing units, filtration, AC, that needs to be really, really effective if you're doing labor camps or any housing. Also, the face coverings, it's pretty much the same. You're going to be required to provide face coverings for the housing employees. Cleaning and disinfecting, this is going to be a big one because I know some of the labor camps, they use a lot of the pots and silverware and you name it. So all this unit, kitchen, bathrooms, and common areas effectively clean and disinfect at least once a day to prevent the spread of COVID-19. So you have to have someone who's going to be responsible for disinfecting a lot of these housing unit utilities and so on. Unwashed dishes, drinking glasses, cups, eating utensils, and similar items should not be shared. So that's very important to keep that in mind. So the housing element, I think it's a big one if you're providing housing. On the screening, we will encourage residents to report COVID-19 cases too. There you would write down the person who is responsible or of making sure that this is being implemented. And also the COVID-19 testing, we will establish, implement, and maintain effective policies and procedures for COVID-19 testing for occupants who had COVID-19 exposure, who have COVID-19 symptoms, or as recommended by your local health department. So in the housing portion, it's going to be something that you will be offering at no cost to the employees for the testing. Even though they're outside working hours, when they're living in your housing, that's still going to be applicable to your responsibility. Isolating the COVID-19 cases and persons with COVID-19 exposure. You will effectively isolate a COVID-19 exposure residents from all other occupants. Effective isolation will include providing COVID-19 exposure residents with a private bathroom, sleeping area, and cooking and eating facility. So you need to start thinking of this, which in your housing units, there's going to be this available: a bathroom, sleeping area, cooking and eating facilities. Is that going to be feasible for you to provide? So that's going to be a requirement if in case someone tests positive, you need to have all these measures already planned out and in place. Effectively isolate COVID-19 cases from the occupants who are COVID-19 cases. Effective isolate will include housing cases with other COVID-19 cases and providing COVID-19 cases. Occupants with sleeping areas, I think I already covered that, or it's pretty much the same. Keep confidential any personal identification information regarding COVID-19 cases and persons with COVID-19 symptoms in accordance with the CPP, investigating and reporting COVID-19 cases, and isolation in accordance with the CPP exclusion of COVID-19 cases or the return to work criteria. So that's pretty much the same on element number 9 and number 10, how you would end the isolation period. So housing, it's a big one. You know, if you're providing housing, there's going to be a lot of homework there, a lot of specific information that you're going to have to identify in this program. The last consideration, it's employer provided transportation to and from work. Ray, can you help me there with this element?
Sure. Can we get caught up on a couple questions really quick though?
Yes.
Okay, so the first one here I have is, next year are employers required to notify everyone within the company in a 24-hour period of a work-related exposure?
Not everybody in the company, anybody who was exposed specifically to that department, that crew, that specific job site. You would report them via a written notification. And we have a written notification sample document in English and Spanish that we will be emailing to all of you, that you can use that template where you would write the company's name. And you obviously it's confidential. You don't never want to expose who was a COVID-19 person who contracted the COVID-19. But we have the sample template to notify employees. Within 24 hours, they have to be notified via a written document.
Okay, and so if an employee reports a positive COVID test after December 31st, but was diagnosed before then, are they still eligible for 80 hours of sick pay?
That's a great question. Let's get back on that one, Ray, because I don't have an answer for that one.
Okay. And there is a job location that has 3 different phases within the ranch. If we get an outbreak on one of the phases, does the whole ranch need to be shut down, or only the phase where the outbreak occurred?
Only where the out phase occurred. But if that employee moved to the other 2 phases, you know, throughout the day or throughout the inception period, yeah, all 3 phases would have to be shut down. But usually it's just the specific job site or that phase that would be excluded.
Okay. So if an employee reports that his or her family member that resides with him or her is COVID positive, the employer does not have to pay the time that said employee is off of work, as this is due to not being work related.
That is correct.
If a crew of field workers have an outbreak, do we quarantine them and send them home until further notice?
Can you repeat that again? I'm sorry.
If a crew of field workers has an outbreak, do we quarantine them and send them home until further notice?
Yeah, that's where we come into the exclusion portion, you know, the exclusion element right there that we talked about. The exclusion of the COVID-19 cases, element number 8, that's where you would do this, these requirements and this standard, that's where you would follow through.
Is it mandatory to issue a written notice to all employees that voluntary use of face coverings can cause problems to the lungs and heart?
No.
And let's see.
And we want to answer all these questions in more detailed. We're going to copy all these questions. And like I said earlier, we're trying to get, for every question, we'll put an answer and we'll go ahead and run it through our legal advice and making sure we have the right answers for a lot of the questions that you guys are asking. And a lot of you are asking good questions. Maybe we're not going to get to all of them today because of the time, but we will go ahead and run it through our legal department and making sure we have all that information to you guys. with the exact answers. And if I said something that it was incorrect, I do apologize. We're absorbing as much as information as we can. We're learning day to day. Sometimes one week is one thing, next week we're learning it's a little bit different. One lawyer says one thing, a lawyer says a different thing. So bear with us. We're trying to get this message information to you accurately. We don't want to mislead you with some information that may be said today inaccurate. So we want to make sure we're very careful with some of the answers that are being answered today. And we want to get this correctly to you, and we'll get that document as soon as we can. So Ray, moving on to.
So this additional consideration number 4 is for those employers that are providing transportation to and from work. And this section will need to be added to your COVID protection plan if there is employer-provided motor vehicle transportation to and from work, which is any transportation of an employee during the course and scope of employment, provided, arranged for, or secured by an employer, including ride-share vans or shuttle vehicles, carpools, and private charter buses, regardless of the distance. It does not apply if the driver and all passengers are from the same household outside of work, such as family members. To employers provided transportation when necessary for emergency responses, including firefighting, rescue, and evacuation, and support activities directly aiding response, such as utilities, communications, and medical operations. Assignment of transportation. We will prioritize shared transportation assignments in the following order. Employees residing in the same housing unit will be transported in the same vehicle. Employees working in the same crew or work site will be transported in the same vehicle. Employees who do not share the same household, work crew, or work site will be transported in the same vehicle only when no other transportation alternatives are possible. Physical distancing and face coverings. We will ensure that the physical distancing and face covering requirements of our COVID protection plan, physical distancing and face coverings are followed for employees waiting for transportation. Vehicle operator and any passengers are separated by at least 3 feet in all directions during the operation of the vehicle, regardless of the vehicle's normal capacity. Vehicle operator and any passengers are provided and wear a face covering in the vehicle as required by the CPP face coverings. Screening. We will develop, implement, and maintain effective procedures for screening and excluding drivers and riders with COVID-19 symptoms prior to boarding shared transportation. Cleaning and disinfecting. We will ensure that all high contact surfaces, door handles, seatbelt buckles, armrests, etc., used by passengers are cleaned and disinfected before each trip. All high contact surfaces used by drivers, such as the steering wheel, armrest, seatbelt buckles, door handles, and shifter, are cleaned and disinfected between different drivers. We provide sanitizing materials, training on how to use them properly, and ensure they are kept in adequate supply. Ventilation. We will ensure that the vehicle windows are kept open and the ventilation system set to maximize outdoor air and not set to recirculate air. Windows do not have to be kept open if one or more of the following conditions exist. The vehicle has functioning air conditioning in use and the outside temperature is greater than 90 degrees Fahrenheit. The vehicle has functioning heating in use and the outside temperature is less than 60 degrees Fahrenheit. Protection is needed from weather conditions such as rain or snow. The vehicle has a cabin air filter in use from the U.S. EPA Air Quality Index for any pollutant is greater than 100. Hand hygiene. We will provide hand sanitizer in each vehicle and ensure that all drivers and riders sanitize their hands before entering and exiting the vehicle. Hand sanitizers with methyl alcohol are prohibited.
Thank you, Ray. So this, once again, if you are providing transportation, you have to meet all these requirements. Transportation, a lot of people are thinking, well, we have company vehicles. Do we fall into this additional consideration? And the answer is yes. If you have company-owned vehicles, you have to comply with this element right here. You know, you have to do all these requirements, standards that we just read for company-owned vehicles. And you have to identify exactly some of the specifics that you're going to be doing besides all these required standards that are applicable to your operation. So those are the 4 additional considerations. Number 1 and number 2 pretty much are going to be kept in your written program because you want to have it there available in case there is a multiple COVID infection and also a major. Number 3, for the housing, if you don't have housing, you can erase this additional consideration. You can delete it. If you don't have transportation, it does not apply to you, you can delete it. All right. So before we answer more questions, I want to finish with all the forms, and then we'll wait to the end to see if we have a little bit of time to ask more of the questions. So let's go ahead and go to Appendix A. This is the form that we're going to identify the COVID-19 hazards. This is like a risk assessment of your operations. Here you are going to have to write down all the areas, activities, work tasks, process, equipment, and material potentially exposed to employees to COVID-19 hazards for all your operations in each of these segments. And you can keep on adding more of these columns that are going to be identified. So all the activities that you guys are doing or equipment, you want to identify them. The places and the time of the exposure that could be, you want to write down those times. And the potential for COVID-19 exposures, employees that could be affected, or to the public or other employees or other employers, maybe clients or third-party personnel. You have to identify that could be a potential exposure. And the existing and their additional COVID-19 prevention controls, including barriers, partitioners, and ventilation. So for that task or that interaction or the area, if you're going to write down exactly what prevention controls you're going to include for that task, you want to identify it right there in that column, that row. So this is going to be a lot of work here for making sure you're doing this risk hazard assessment of your operation. It needs to be completed. You know, we don't want to have this blank. Cal OSHA shows up and wants you to have this already completed and identify all these exposures. So this is a lot of work for to identify all these exposures. So that's the Appendix A that needs to be already identified in your written program of all the potential hazards. And who you want to write down who is evaluating this, the date that it was implemented, and also the employees authorized who are involved with this implementation. You can put their names there. Appendix B, this is the form that you're going to be utilizing for the inspection. This is the one that I encourage for all the management, all the supervisors, foremen at the job sites to be completing it, you know, on a daily basis, pretty much, you know, on the exposure. And you can modify these engineering controls. If it's not applicable to you, you can erase that and put additional controls for your workplace that it's being used. So this is a modification form that you can modify specifically to your operation. In the status row, you would write there exactly, you know, what the status of that inspection. If it's low, if it's medium, if it's high, or if it's okay, you would just write there. If it's okay, if it's not okay. However you want to identify it by the status, you would log it in right there. And if it needs to be corrected, it needs to be fixed, the finding, who is going to be responsible to correct that and the date it was corrected. So this is the inspection form, and you want to train your management, your supervisors, foremen, whoever are going to be doing this inspection, how to utilize this form when you modify it specifically to your operations of everything that you have. So here, we have some engineering sections, the administrative section and the PPE section, you know, so you can add more sections, you can modify this form. Like we said earlier, that could be more specific to your operation. Outdoors, indoors, packing houses, sheds, you can modify it. They give us excuse me, pretty much Osha gave an example of some of these exposure controls that you can take into consideration for the inspection portion. Appendix C. Appendix C, pretty much this is the form that needs to be completed investigating the COVID-19 case. So if there's a positive COVID-19 case in your work area, this is the form that's going to be utilized. At the date, you're going to fill this out and the name of persons conducting the investigation. You're going to write down the employee or non-employee's name right there, their occupation, why they were in your workplace, if it's a non-employee, a vendor, or a third party, excuse me, the location where the employee worked, date investigation was initiated, the COVID-19 test offered, it's either yes or no, name of staff involved in the investigation, date and time the COVID-19 case was last presented in the workplace, date of positive or negative and or diagnosed, date of the case first had one or more COVID-19 symptom, information received regarding COVID-19 test results. Even though we're not required for them to show us, some employees, bring a doctor's note or bring a doctor's note saying they had a negative test. So if they show you a negative test, well, you can write that down there in this investigation, even though we're not required to ask for a negative test.
Alfredo, can we
Yes.
provide these forms in Spanish?
They are in Spanish in our Spanish program. So when we send out this written program to all of you, we send it out in English and we send it out in Spanish. So all these forms are available in English and Spanish, the programs that we send out. In this section, the results of the evaluation of the COVID-19 case and all locations of the workplace that may have been visited by the COVID-19 case during the high risk exposure period. So here you would identify, someone asked the question earlier about the 3 phases. So this employee was in different job site or different phases. You have to identify where that employee could have been exposing other workers or other areas. In the bottom, notice given within 1 business day in the way that does not reveal any person identified. So here you would keep track of the date, the names of employees that were notified, the date, independent contractors or other parties that were notified in case it's not your direct employees. If you have to report it to other people, you have to write it down there and log it. That were the workplace conditions that could have contributed to the risk of COVID-19 exposure. So you would write those conditions there. They were contributing to the risk of the exposure. What could be done to reduce the exposure to COVID-19? So here you would do an evaluation of what you are going to be doing to making sure that this does not happen again, or how you reduce the exposure to the COVID-19. And with the local health.
Alfredo, I'm sorry, could one of those answers be, we're getting questions here, where what do you do if the employee refuses to wear a face covering or they refuse to get tested?
So face covering, if they're going to be working close to other workers, they're going to be required to wear face coverings. It's not going to be pretty much, someone asked yesterday, can we discipline an employee for not wearing a face covering if they're working close to another employee? The answer is yes. You have to. This is a regulation. This is a standard. It's like wearing, goggles or any other PPE for the task or the job that they're doing. If they're not doing it, you have to enforce your company policy by your disciplinary progressive program. So they're going to have to be held accountable.
And then what about the test? Can you go ahead? I'm sorry.
The testing, once again, we cannot require people to get tested. We can recommend. Did I answer that correct, Ray?
Yes.
Okay. So I know it's a lot of work for you guys on all these forms. We really want to let you know if you guys need additional assistance. As soon as you complete your program. If you want to run it by us so we can look at it again and making sure you have everything according to your operations, we're here to help out and support. Reach out to your direct loss control consultant in your area. I know we have a lot of people today, different parts of the state of California that are joining us for this webinar, but whoever is your direct loss control or your producer agent, if you want them to do a review of the program after you completed it, share it with us. We'll review it and give us a final thought on reviewing your program. And obviously, the last portion of the Appendix D, it's keeping track of the training. So we put the training roster here. Anytime that your foreman, supervisors, management are training on all these measures of the required training, you want to document that you did the training. So we put the roster up here, so you can use this roster to do the training for your program. Complex program, right now it's only a temporary program until October the 1st. We hope that this pretty much expires then and they do not prolong that further out, but we want to make sure that we have this already in place. It's an effective program. It's almost the same as your injury and illness prevention program. All these elements have to be met, and they need to be training all the employees and keep record of all that.
Alfredo?
Yes.
2 quick questions here. Since a lot of the employees in the ag industry work in the field, is it required that they wear face coverings?
So if employees working outdoors and they do not have other workers within 6 feet of distancing, they're pretty much separated 15 feet apart, or they're by themselves in a tractor or outdoors, they don't have to wear the face mask. The face masks are required if people are going to be working very close to each other within 6 feet or so. But I mean, if they're working 8 feet apart, that's like, you should wear a face mask. You're getting too close to somebody else. It's all how we want to communicate these employees, but yeah, if they're working alone, people can choose to remove their face covering when they're working alone.
And someone else, kind of not a question, but kind of a statement that the Department of Labor told them that if an employee has come in contact with a positive subject and they have to self-quarantine, they have to be paid by the employer.
Can you repeat that again? I'm sorry.
Sure. It says, I was told by Department of Labor that if an employee has come in contact with a positive subject and they have to self-quarantine, we have to pay them.
Yeah, if it's happened at exactly that answer, that's what it is. And a lot of these questions, like I said earlier, we're going to write all these questions down and we are going to make sure we have the answers back to all of you. I will go ahead and email everybody the question and answers portion as soon as we have it available. I'm also going to be providing that template for the worker notification in case there's a COVID-19 exposure documentation that you need to let employees know of a COVID-19 case. Let me see here. Any other questions? I know there's many questions here that we can try to answer as much as we can. I know a lot of these are legal questions sometimes that we need to be very careful with answering and giving you some of this information incorrect. So any others, Ray?
That's it.
Okay. So once again, we will copy all these questions. We will get them and send it back to you as soon as we have all these answers. So we'll go ahead and do that. And we really thank you guys for the opportunity to be here today. And I know this is a big program, but we have to do what we have to do, making sure it's established and it's effective. We thank you very much for being here today. This was recorded. So the recording of this presentation, if you guys want this recording, we can also send it to you guys. So you guys can also have the recording of this webinar as well.
Okay.
Any other things, Ray, before we conclude today's meeting? Any other question? Anybody has any questions? You can unmute yourself if there's anything that we did not answer. We got a couple more
Alfredo?
minutes here.
Alfredo,
Yes.
I have a question. I sent in the question regarding the contact with DOL, and DOL had told me that, because I explained to them that we had an employee who came in contact with a positive subject, positive for COVID. And DOL, I asked him if I had to pay him the 80 hours because he had to self-quarantine, and they told me he did, but the exposure was at home, it wasn't at work, but they still told me I had to pay him.
So that employee was working and he was exposed to someone who was positive, but that employee was actually working hours with you. So he had the exposure, right?
Yes, but the exposure happened at home, and he didn't find out till, well, he found out the very next day because his family member went and got tested, and they told him that he was positive. But what I mean is the exposure didn't happen at work.
Okay. So thank you very much, Miguel, for bringing that up. And once again, we'll get that question. I think that is correct on that. I know we said earlier it has to be work related, but we'll get that clarified. We want to make sure we get that clarified. If it's the exposure is outside of work and work, the 80 hours and all that. I know there's a lot of questions regarding the sick pay, the 80 hours. When do we have to pay? When do we start paying? When the symptoms showed up or when they showed a positive test? So those are a lot of good questions that we want to make sure we have some answers to you guys on that. Thank you, Miguel.
Thank you.
Thank you. Anybody else has any other questions they want to ask?
Hi, I do. I have a question.
Yes.
So are you going to automatically send us all this to our email, or do we have to request it?
You know, we have all the emails, the people who logged into this webinar. We will send you the question and answers.
Mm-hmm.
We will get those answers all to you guys. We'll get the forms for the notifying employees, and we'll also try to do the webinar recording of this recording as well.
So this pamphlet here, I haven't received anything. Am I going to receive that as well?
Which pamphlet?
What we went through.
This the written program?
Yes.
Yeah, the written program. You should already had it by your producer. Your loss control should have sent it to you. If you don't have the written program, this one that we went over in English and Spanish, you know, let us know immediately so you can start working on this program. And
Yeah, because I didn't receive anything.
You haven't received anything? Okay, we'll make sure we get it out to you ASAP. You have my email?
I believe so, on the email that with the confirmation email, right?
Yes, on the confirmation email, it's my email there, and I will go ahead and send it to you guys as well. Well, what I'll do, I'll just go ahead and send the program again to everybody, the English and Spanish written program again, if you did not get it.
Okay, sounds great. Thank you.
Thank you so much. So thank you very much, everybody, for being here today.
Sorry, I have a question.
Yes, go ahead, Karina.
So before like all this information came out and we were allowed to have like webinars and get information, like the first cases of COVID, we paid out some people their 80 days, even though it wasn't work related and all that. This was
80 hours.
the 80 hours, sorry. 80 hours we paid them out, and this was like a handful of people, probably like 10 or 11. Will we get penalized for that?
No, I mean,
Okay.
whatever you paid out, I mean, the way that people are gonna keep track of what all those 80 hours that you guys paid out, it's when you do your tax purposes, all those are gonna be as a credit. That's what I was told. You know, it's not gonna be like something you're gonna get reimbursed from the state or anything. You're gonna report that as a tax credit when the company does their income taxes. That's what I was told.
Okay.
Yes. Thank you, Karina. All right. Well, thank you once again, everybody, for being here today. And if you have any more questions and concerns with anything of this, please reach out to your loss control consultant, your agent. You guys all have my email on this registration form that we send out. And we'll try to help you as much as we can. Thank you for being here, and you guys have a great day.
Thank you, Alfredo.
Thank you so much.